Good afternoon. I'm Dr. Elligan, and I'm a clinical psychologist based in Chicago, Illinois, and this is Everyday Psychology. Today, I will be talking about what is the field of psychology, since we're going to be talking about how to utilize some of these psychological techniques in everyday life. What is psychology? So psychology, in a nutshell, is the study of behavior and mental processes. And what we mean by mental processes are how people think and how people feel. So the area of the domain of psychology is cognition, affect, and behavior. Cognition is how people think, affect are your emotions and how you feel, and behavior obviously is how you interact with the world and behave. So psychology is the study of CAB, like a taxi cab, a cab. Cognition, affect, and behavior. There are many different domains within the field of psychology, and each of these domains focuses on cognition, affect, and behavior in a different way, but they will always focus on, if not all three of these areas, at least one or two of them. So the first one that we'll talk about is lifespan development. So there are many psychologists that are referred to as developmental psychologists, and what developmental psychologists oftentimes will be focusing on with respect to CAB is how does cognition, affect, and behavior change over the course of a person's life. All right. So how is it that a 18-month-old who's just learning to speak, how do they think, feel, and behave differently than a 3-year-old who actually can put words together and form a sentence and a paragraph and express their emotions to a certain degree? These children only have a year and a half apart, but their cognition, their affect, and their behavior are dramatically different. All right. Likewise, for that 3-year-old, how is his thinking or her thinking, feeling, and behaving differently than a 10-year-old, a 20-year-old, a 30-year-old, a 40-year-old on up through the lifespan? We know from a developmental perspective that as people age, their thinking, their feeling, and their behaving changes for a variety of different reasons. So one of the areas in the field of psychology is lifespan development or developmental psychology. Another area is personality, and personality, like lifespan development, focuses on thinking, feeling, and behaving, cognition, affect, and behavior. But the difference with personality is we're looking at not how cognition, affect, and behavior change, but how do they remain constant throughout the person's life. So that 3-year-old who's thinking, feeling, and behaving may be different once they're 33. What is it that's stable in that thinking, feeling, and behaving that defines who they are, so that their parents, when they see them at 33, say, I remember when you were talking about these types of themes when 3 years old. There's some consistency. Or you graduate from high school, come back to your reunion 20 years later, and people recognize you as you, that this is my old buddy John, despite the fact that John may dress very differently, he may have changed his religion, he may have changed his lifestyle. There should still be a relative consistency in his thinking, feeling, and behaving, and that's what we refer to as personality. Okay. Social psychology, another broad domain in the field of psychology, and that is basically how the social environment and other people influence our thinking, feeling, and behaving. So once again, CAB is a consistent theme that comes up. How are we influenced by others? So some of the areas that are studied in social psychology are conformity. Why is it that people conform or comply? Why do we obey the rules of leaders? Love is another big area in social psychology. Another big area is what's referred to as the bystander effect. Why is it that people are more likely to watch someone get injured and not help when they have what's referred to as diffusion of responsibility? When other people are watching, why is it that we feel like we don't have to help because someone else will help? Once again, people in the environment influencing our thinking, feeling, and behaving. Big area of psychology. Another area is health psychology. Health psychologists focus on how to modify people's cognition, affect, and behavior in the interest of maintaining a healthy lifestyle. So oftentimes you'll find health psychologists working in hospital settings, many times in oncology units, people with cancer who may be developing some depressive qualities. Their thinking may become a bit negative because they may think that their diagnosis is fatal and that they aren't going to live long. But that thinking can lead to a self-fulfilling prophecy. So health psychologists oftentimes are trying to help people remain optimistic despite the fact that the diagnosis may be grim. So that's health psychology. We also have clinical psychologists. I am a clinical psychologist. And clinical psychologists focus on some of the disorders or challenges that may be interfering with a person's happiness and satisfaction with life. So oftentimes clinical psychologists are looking at how their thinking may be somewhat dysfunctional. So oftentimes people who are depressed, their thinking tends to be a bit more negative than positive. And how can we change that thinking so that it's a little bit more optimistic? Obviously, someone who's depressed, depression has an effect on your feelings, which is affect in CAB. And then with respect to CAB, people who are depressed, their behavior tends to change. They tend to socially withdraw and not engage in hobbies and spend time with friends as they did prior to being diagnosed with depression. So clinical psychologists are trying to help people live a happy life despite all of these different diagnoses that they may have. And we're just using depression as an example. Another area within clinical psychology oftentimes is psychotherapy. And I kind of mentioned that with the cognition aspect of depression. How do we change the way the person is thinking? So psychopathology, psychotherapy, all parts of clinical psychology. Another big area of the study of psychology is learning. How do people learn a variety of things? And on a very fundamental level, learning oftentimes takes place through association, which we call classical conditioning. Learning takes place through both positive and negative reinforcement, which we call operant conditioning. And learning oftentimes takes place through modeling, which we refer to as observational learning. So on a very fundamental level, people are learning through relationships and through association. They're learning through reinforcement, and they're learning through observation. The reason that this is the fundamental or the basics of learning is because if you think of toddlers who can't speak yet, they learn a great deal of information. They've learned their mother's voice. They've learned that bedtime starts at a certain time, and they can't speak. So a lot of this learning is through reinforcement, through association, and through observation. So that's another big area of psychology. Other areas may include industrial organizational psychology, which is the psychology of the workplace, and how do we help employees perform at their maximum level and reach their fullest potential in the workplace? How do we reinforce and support workers in the workplace? Oftentimes, people think that the primary motivator for workers is money, but research studies have shown that although money is important, it isn't the primary factor that influences if people are happy and satisfied with their job. Oftentimes, it tends to be more intangible things like work-life balance, relationship with colleagues, relationship with their supervisor, time off, benefits, things of this nature. So industrial organizational psychologists look at psychology in the workplace. And there are a variety of other psychologists. There's sports psychologists, which we'll talk about in another section of everyday psychology. But this is kind of an overview of some of the different domains of psychology. So once again, in review, psychology is the study of cognition, affect, and behavior, which is CAB. Many different types of psychologists. Some of the ones that we've discussed today are developmental psychologists that look at how thinking, feeling, and behaving changes over the course of the lifespan. They're personality psychologists that look at how those three elements remain relatively stable over the course of the life. Social psychologists looking at how the social environment and other people influence our thinking, feeling, and behaving. Health psychologists, cognitive psychologists that are focusing on learning, industrial organizational psychologists, sports psychologists. There are a variety of different types of psychologists out there. So psychology is a very broad domain, and we will be reviewing some of these different domains in this Everyday Psychology series. But I'm Dr. Elligan, and this is Everyday Psychology.